I'm Natalie, and I had a rare condition called styloidogenic jugular venous compression syndrome, which was not originally the condition we thought was giving me trouble.
Natalie's condition is one that there's something definitely wrong that did not fit in a category that we currently teach in schools, that we have generally accepted. And sometimes when that happens, things hide in plain sight.
By my senior year in high school, I was using a wheelchair most of the time because of loss of motor function and loss of strength.
Arterial disease of the brain, where arteries pump up from the heart to feed the brain, are things like aneurysms and AVMs and things that everybody knows. There's no argument about what they are and what the concerns are. On the drainage side, many people are not aware that there are any diseases, but in fact now we know that there are many, many of them. Natalie, she suffered from a condition of congestion of those veins, which is very unusual.
I've had severe headaches for as long as I can remember, which then turned into migraines. And the brain fog was very difficult to work through, and just the overall pain. There were times where my legs would paralyze and I couldn't move them. And so I didn't really have much quality of life before surgery, especially because my condition got progressively more symptomatic.
Imagine if you had a turtleneck that was way too tight around your neck. Not enough to cut the blood flow going up to your brain, but enough that your eyes were bulging, your head was pounding, you were dizzy, you heard ringing in your ears, all these things, and it was like that for years and years and years, or even decades.
It was frustrating because it felt like a lot of doctors weren't taking me seriously, or they didn't believe my symptoms, or they believed my symptoms were too vague. I've had doctors say to me, we'll probably never know the cause. That's really disheartening to hear when you know that you're suffering a great deal and it seems like no one cares. We thought I was having trouble with Eagle syndrome, which brought me to Dr. Nakaji. I do remember waking up from surgery, not knowing that I had had a completely different surgery than the one that we thought I was gonna have.
It was literally basically like a band of soft tissue and muscle that was strangling that vein. She was highly dependent on the one vein that was being strangled, basically by her own anatomy.
He found that out during surgery. When they cut into my neck, he could see my jugular veins bulging. The blood flow was getting cut off by the carotid sheath.
Once we opened it up, it completely changed the landscape of her brain and all these things that were wrong. I wasn't sure that she would respond as well as she did.
I was able to get up and down off the floor by myself, and I had my strength back, I had my hearing back, and my smell and my taste were back. It was that fast.
She knew right away. Sometimes it's like a bubble popping. She looked dramatically different. Imagine a pond which is flooded and it's all over your house and your yard and your driveway and everything, and there's 50 things wrong. And when the water level goes down to normal, all those things go back to normal.
A few days before surgery, I had gone to hand therapy for the first time, and they tested my strength, and I had 7 pounds in one hand and 17 in the other, which based on their score was a 0. So I had very, very little strength. And then I think it was 4 days after surgery, I went to hand therapy, and in one hand I had 59 pounds, and in the other I had 61 pounds of strength. The next day, Dr. Nakaji came to check on me in the hospital, and I just hugged him and cried and thanked him because, it was just a miracle. I couldn't really think about my future. I was so focused on surviving in the present.
To see her now, come walking into clinic instead of rolling into clinic, to see her able to be up and around and the light in her face when she's not passing out and she can think straight and she's not having to struggle to do the things she loves, she can just do them, is amazing.
I have so many more options now. I'm now able to play my cello again. With months of hand therapy, I've started my artwork again, which has also always been a big part of my life.
Listening to her play music, or to see that something she's painted, just to see the enjoyment she's getting in life. That's priceless. You can't even begin to think about how great that feels.
I haven't passed out since surgery. Like, it was a flip of a switch. It's just nice to feel like you're not just another data point being pushed through the medical system, and instead you're a human being who needs help and no one else will help you. And so it's just like, they're just like a light. You're in good hands. You're in really good hands.